We have this vaccine. We know it works in African Americans. We know it works in Latinos. And frankly, it's just the beginning of our journey. It was very clear that the COVID-19 pandemic was having a disproportionate impact on multicultural communities, and that if a vaccine were to be developed, that it needed to work effectively in the multicultural community, specifically the Black and Brown community. The moment that I felt like I was personally making a difference, frankly, was when the emergency use authorization came through for Pfizer's COVID-19 vaccine. The clinical trial team approached the MHEC, the Multicultural Health Equity Collective, because of the sustained relationships, the trust that we had built with the multicultural community over the years, to share information, to educate the community, to educate those community leaders about Pfizer's clinical trial, and to request that based on the information that their constituents would consider being in the Pfizer clinical trial. I knew that clinical trial, the emergency use authorization, included my people, included African Americans, included Hispanics. It was a day that made all of us involved in this effort feel like we've conquered the world. We, as a collective team, made a difference, not only for one population, but for everyone. Developing relationships, frankly, developing friendships really paid off. Not just for me, but for my community as an African American. The work is not done. My work is not done. Pfizer's work is not done. We still are being disproportionately impacted. And when I say we, I'm talking about African Americans. I'm talking about the minority community. We can't do this by ourselves. We have to have these partners, these community leaders, to be part of the trusted voices with Pfizer's voice. What matters the most for me in 2021 is that those people who are offered the vaccine, who want the vaccine, who need the vaccine, takes the vaccine.